and we are talking to John McCain. Okay, all right, Dr. John McCain. It's not even spelled the same way. Are you always patient with the tasteless folk who come up and do John McCain jokes?
Well, I've gotten used to it over the years, so you just have to kind of roll with it.
You don't punch anybody out, or
no,
okay.
That wouldn't be helpful.
Said appropriately, considering the fact that this McCain is a clinical psychologist and clinical supervisor for the Bayless Healthcare group. Now, listen, we've got to talk about some things that are potentially serious, but don't have to be, sure, with mom and dad's help, right?
Exactly.
Do we know that summer is a particular problem for kids, particularly adolescent kids, young adolescent kids, when it comes to substances?
Absolutely. It's really clear that substance really spikes upwards during the summer.
Just because of time?
Partly because of time, the additional time, the lack of structure. Also, kids are rebounding from the stress of school and not having alternative ways to find ways to calm down and to engage in healthy activities.
If you haven't been aware of any problem in your family, what are you suggesting that parents look for in order to stave that off ahead of time?
Well, you know, although being moody and teenagers hand in hand, what you're looking for is more extremes in terms of mood changes and also defensiveness. Teenagers are private and you're not going to know everything about what's going on, but when they become hostile in terms of asking questions about what's going on, you probably ought to pay attention.
It just seems to me that every teenager I've ever known in my life, including mine, have been inclined, if you do ask a question, even passively, they've often been inclined to respond with, "What's the matter? You don't trust me?" And a lot of eye rolling.
Exactly.
Or isn't that defensive?
It is defensive, but the problem is they're right. We ask questions that are accusing, as opposed to asking questions like, "What do you think about kids using drugs today?" Or, "What do you think about the fact that it seems like drug use goes up during the summer?" We have to have conversations with kids that are normal and ongoing. That way, when it comes up, it's part of your relationship. You just talk about things.
But are you saying that mom and dad really are in charge of the way these things go?
Not in charge, but you can influence it.
What do we do about the medicine cabinet?
The medicine cabinet, you have to be careful because there's abuse of drugs, whether it's Adderall or Ritalin for stimulants. So you have to be cognizant of the fact that curious kids, kids that are looking for something to use and even sell sometimes, are going to be looking around to see what they can get into.
Yeah, but what do? You don't want to lock on the medicine cabinet because that immediately says, "I don't trust you enough to talk to you."
Well, the other thing too is where's the medicine cabinet? And it's a larger relationship kind of thing. There's privacy. Kids talk about privacy. There's privacy of parents too. But it's about an ongoing conversation, and it is about trusting your kid, but trusting them so that you have conversations before the problem comes up. What's really clear is research says that you can reduce substance abuse by 50% just by having ongoing conversations with your kids about drug use.
Starting when? How young?
Starting, I would say, at least by junior high school. Drug use with kids is creeping down lower, so by the time your kids are involved in elementary school, they've already been exposed to drugs.
But in reality, they do, from what I've read, begin that potential path at home so often because of the things that mom and dad have around.
Well, this raises a great point. There's no room for hypocrisy. If you're in a household and you're saying, "Hey, I feel like a drink after work," you're planting seeds in your kid's head that the way you manage distress and emotions by putting chemicals, drugs, and alcohol in your body. And that's not a good message.
All right, but then is the answer then, according to Dr. John McCain, that we all just swear off?
No, the answer, according to the kids that I talk to, is honest conversations. Having honest conversations. Now, with adults, you have to realize the kids are watching. And swearing off drugs to alter your mood, swearing off alcohol use for altering your mood, absolutely. There's no room for hypocrisy here.
We've got about 10 seconds. The biggest mistake, off the top of your head, the biggest mistake that parents make when it comes to their kids and any kind of substance,
is not talking. observe and talk. Keep the conversation going. Don't wait until there's a problem.
But isn't one of the problems with talking the fact that a lot of times mom and dad have no idea what they're talking about?
That's why you also have to be informed. Okay, you can talk to professionals, get information, but you don't have to know the answers. You just have to know the right questions to get a conversation going.
How about a question like, how do we get in touch with Bayless Healthcare?
Okay, that's a great question. And you can reach us at our website, baylesshealthcare.com. We also have phone numbers for information, 602-230-7373. Feel free to call, ask questions. You don't need to have a problem to use us as a resource.
And when you ask for John McCain, they'll understand which one you're talking about. This is Pat McMahon on the Morning Scramble.